I'm Camilla. I'm the registrar.
Hi.
Are you one of the new students on with us? Hi. Well, one of your colleagues mentioned that you guys wanted to talk about Kawasaki's disease.
Yeah,
is that right?
We saw a patient with Kawasaki's disease, so...
Okay. And when did you see them?
We saw them yesterday on the ward round, but I've not really heard about it before, so...
Okay, well that's fine. We can talk about Kawasaki's disease and just go through a few bits, see what you know already, and then we can talk about like how it's treated and see maybe where you can find out some more information about it. How does that sound?
Yeah, sounds good. Okay,
well tell me what you saw yesterday on the ward round.
So she'd just come in really miserable, really miserable. I've been in A&E with one of the other doctors, and she just looked very sort of red-eyed and had a temperature, and then they admitted her and put in a drip and did some blood tests, and I just didn't really know how you decided it was or wasn't Kawasaki's disease, because quite a lot of the children seem a bit miserable, temperature and...
Yeah, well that's right. I mean, that's really good. You've noticed some of the important features about Kawasaki's disease. And actually it's one of those diseases that your diagnosis is based on clinical findings. So your history and examination is really important for making a diagnosis. And how old was the child you saw yesterday? 4. Okay. And so you said already that she's had a fever. Do you know how long that was for?
I can't remember actually.
Okay, well that's one of the important things about Kawasaki's, is that to diagnose it you need to have had a fever for over 5 days, okay? And you said that she had red eyes.
Yeah, red eyes.
Did she have any sort of oozing out of her eyes? No, okay. Well, again, that's another one of the important things, that it's a non-purulent conjunctivitis they get.
Yeah.
Okay. And anything else? Anything else that she had when...
She was really miserable.
Yeah. I mean, that's one of the classic findings in children with Kawasaki's. It's not one of the specific criteria for diagnosing it, but it is something we always tend to see.
Okay.
So there are a few other criteria we see. Do you have any idea about what they might be?
Not sure.
No. Okay, that's fine. So basically when we examine any child, we want to take a general look at them, okay? One of the first things you're going to look at is their hands, a general inspection. So sometimes children with Kawasaki's will have obvious changes in their hands. They can be really swollen and puffy, and that can be the same in their feet, okay? And that's one of the criteria for Kawasaki's. Okay, so then moving up, you're just, when you're doing your examination, you're going to look at their arms, the general skin, okay? And they can get a rash, okay? So it's fairly non-specific, but quite often they will have a rash somewhere or other. And all of these signs can be present at one point, but then they can disappear, okay? Yeah. So if they've been there at all, it's important to consider them. So that's why it's important to take a detailed history as well. Okay? So you've got, looking at the hands and feet, you're going to get, what are you going to get?
Swollen.
Yeah, maybe swelling. And then skin.
A rash.
Yeah. And then
the conjunctivitis.
Exactly. And then moving down, you look at their sort of lips and mouth. Any idea what you get there? What does hers look like?
They get red tongue.
Yeah, exactly. So you can get changes around the mouth and lips. Red tongue, red lips is really classical. Okay, and all children when they come in A&E, you do ENT examination, don't you?
Yeah.
Good. So when you're feeling for lymph nodes in the neck, then one of the signs and criteria is having significantly enlarged cervical lymph glands, okay? So really good size, over 1 centimetre. Okay. So cervical lymph glands, and then you've got all your features of Kawasaki's.
Yeah.
Okay. And later on, they can get peeling of their extremities, so peeling the fingers, peeling around the lips, and things like that. Okay.
How do you treat it?
Well, you can tell me that. You've seen a few things we've done already. What did we do?
They put in a drip, but I'm not sure what was going in the drip. And they did start aspirin.
Okay, perfect. So we do start high dose aspirin.
Yeah.
And you're right, there was something going in through her drip, and it's called intravenous immunoglobulin. Have you heard of that before? No. Okay. Well, that's one of the mainstays of treatment in Kawasaki's, and basically that tends to reduce their fever, and we see all the signs generally improving after we've given that. Usually give it as a one-off dose. If it doesn't improve, then we can try giving it a second time. Okay. And then if it's still not if the whole condition's still not improving, the fever's not going down, then we can think about other treatments like steroids. Okay. But yeah, you're right. Aspirin and intravenous immunoglobulin are the main things about treatment. Now, there's something else that we always think about in Kawasaki's, sort of longer term. Do you know what that is?
Yeah, they're talking about getting an echo.
Yeah, and do you know what they were looking for with that? Okay, so when you do an echo, basically you're seeing the structure of the heart, and one of the complications of Kawasaki's disease is having aneurysms. Okay. So enlargements of the vessels, and this kind of problem can lead to ischemia, and in some children they get myocardial infarctions. So it's really important to do screening echoes. Okay. And having changes in the heart isn't a diagnostic criteria, but it is something that happens in Kawasaki's. So we always screen if we think that this is a diagnosis. Okay. So I know we've gone through a lot today.
Yeah.
Do you want to just recap what you've learned?
So I know we went through that you start with the hands and you go up and you think about all of the different signs of Kawasaki's, and we've gone through the treatment options as well, that it's aspirin and this immunoglobulin, and about the heart.
Good, well, that's brilliant. Well, I think you've really got the handle on that. What I think would be really nice would be if maybe you presented the child you saw yesterday in our morning teaching session, and then you could maybe teach the others, because I know they couldn't make it today, so because I know they all asked me if we could go through it, so yeah. I mean, what do you think about that?
Yeah, that sounds good.
Yeah, I can show you some websites if you want, where we can get some good information.
Okay.
All right.